Okay, good afternoon, guys. Good afternoon. Please, can you turn on your camera? This is the rules of university. You should to turn on your camera, and then I will check your attendance. So please do it fastly. We don't have time. А? Я всё. Спасибо. Спасибо, Леонидович. Guys, okay. Leader of this group, Zohar Muhammad. Okay. Okay, let's start our practices. So today, actually, we will talk about my subject. How do you think? What study my subject? What study my subject? Hafiz in Inshra. Can you tell me, please, what study my subject? What about my subject?
Yes, ma'am. Internal medicine is dealing with the prevention, diagnosis, and treatment of internal disease.
Okay. So, what is the purpose or what is the goals of my subject?
Goals are etiology, pathogenesis, and clinical manifestation of disease of internal organ. It also develops
Okay.
methods for their diagnosis and prevention.
Okay. So, actually, my subject is about how to check the patient, or which or what kind of way actually we use to check the patient. This is the my in this semester you will study. This is one, how to check the normal human healthy person, and how to examine them. And the next semester you will study to examine unhealthy person, unhealthy person. So in the next semester, you will study the syndromes. In this semester, we study actually how to check the patient. Okay. Okay. Can you tell me, please, what does mean the words preventing, Usama Rahman? What does mean the words preventing? Usama Ahmad, turn on your microphone and say me, please.
Ma'am, stopping something that happened.
Okay, Mariam Sabir, tell me, please, what does mean prevention?
Ma'am,
Ma'am, देखिए
prevention
ma'am,
means
stopping.
to stop something from happening.
Okay, for example.
Ma'am, for example, certain diseases like we know food poisoning is a disease, and we can prevent it by cooking our food properly, washing our fruits and vegetables properly, so we can stop it from happening.
Okay, what else? What else? An example. Give me an example please, of prevention. An example.
Ma'am, for example, we can protect our heart from heart attack by not smoking and not taking bad things and having a proper diet.
Okay, so means preventing, an example of preventing is the vaccination. Whole the world right now trying to find the vaccination to check to win COVID-19. So preventing, an example is the vaccination. So if you put the vaccination to the patient, so he will be prevent from the future coming diseases. Okay, for example, we have flu. We have flu. An example, flu. This is the flu actually comes from the virus, but we cannot make a vaccinations properly from the flu because the genes of the virus is the change all the time. That's why in the winter season, in the autumn season, in the cold, this is the virus and the flu is grow up. So now, for example, we are trying to make the vaccination against the COVID-19. This is the means preventing. What does mean diagnosing? Who can tell me? Shah Wali. What does mean diagnosing?
Ma'am, diagnosis is the method by which we identify the sign and symptom of disease and recognize its function, characteristic, etc. Or the conclusion or main idea which we gain through the diagnostic procedure is called diagnosis.
Okay. Um, Yes, so if the patient get the diagnosis, so diseases, so our job is find these, research these diseases, find, investigate these diseases, and give the diagnose the patient. Okay, thank you. Next slide, please read Mansur Khan.
Yes, ma'am. Internal medicine is the field of clinical medicine that study etiology, means the cause and origin of disease is called etiology, while the pathogenesis means the development of any disease in the human body. And clinical manifestation means sign and symptom of the disease of the internal organ. Develop method for these diagnosis and prevention. Diagnosis mean the identification of diseases. For example, a person having malaria, then we identify by its sign and symptoms. And the prevention we can prevent the risk of it.
Okay, okay. So you see, guys, what we do, we are actually you can notice our subject, the any clinical subjects, very closely related to etiology and the pathogenesis of the pet phys. In your pathophysiology you will study etiology and pathogenesis. When you will get the etiology and pathogenesis of the systems, then for you, very easy will be identify clinical manifestations. Okay? So my subject is the actually therapy. So my subject actually therapy. Propet therapy, it means when we are introduced to the therapy, because the therapy is the huge science, the huge science. So that's why if you are gonna be therapist, You should to learn it very good. Internal medicine science, actually therapy, but not all the systems. I will tell you later. Okay, read the slide. Shah Wali Khan.
Yes, ma'am. The purpose of pediatrics to provide a basic for a rational approach to assessing the main manifestation. Pediatric task mastering the basic physical research method identification of main symptom and syndrome encounter in disease of internal organs. General acquaintance with the most common disease of internal organs.
Okay, so tell me please, what is the purpose of pediatrics, Shah Ali?
Mem pediatrics is a historical term introducing about the history of patient and study the science in all its ramifications. The study of pediatrics of internal medicine disease teach us the method of clinical examination of patient, methods of laboratory or an instrument, diagnostic and syndrome disease, diagnostic of internal organs. Disease as the basic of fundamental principle, discipline principle.
Okay, okay,
I am, for example, anatomy and physiology.
okay. Let's see what is the chat. You should to understand the differences between diagnosis and diagnostics. So read the slide, Mansur Khan.
Yes,
Mansur
ma'am.
Khan.
Diagnosis are diagnostic. Diagnostic are basically, ma'am, the Greek word which mean the knowledge is the science of method by which diseases are identified. Means a person come with the doctor, then the first priority of the doctor is to identify the disease. For example, a person having malaria, then we see the sign and symptom like the rashes, plasmodium, etc. While the purpose of identification of medical condition or disease by its signs, yes, ma'am, by its signs and symptoms we can diagnose it. While the by these signs and symptoms we get the result. This result is called diagnosis.
Okay, so diagnosis and diagnostics. So how do you understand what does mean diagnosis and diagnostics? Can you tell me please?
Yes, ma'am. Diagnostic is the knowledge, the science or method by which diseases are identified.
How you
While the
understand? Can you tell me please an example of diagnostics?
ma'am, ma'am, I give example, but there is something wrong. But I repeat, ma'am, the example of diagnostic is like malaria.
No.
We can see its signs and
Okay, okay,
symptoms.
okay. I
While
understand.
while getting
Okay,
while getting this result is called diagnosis.
okay. How can you understand diagnosis? How you understand diagnosis? Okay, you understand diagnostics, but how you understand diagnosis?
Yes, ma'am. The ma'am, diagnosis is the result or the main idea which we gain through the diagnostic procedure.
I'm sorry, guys. Give me please a few minutes.
Okay,
Now you hear me?
Yes, ma'am.
Now you hear me, guys?
okay, ma'am.
Yes, ma'am.
Guys, you hear me?
Yes, ma'am. Yes, ma'am.
Yes.
Do you hear me? Okay, okay. Let's see. Please read this slide. Shah Wali Khan, read this slide, please.
Diagnosis or diagnostic. Diagnostic include medical diagnostic
Shah Wali
technique.
Khan, read this slide. I cannot hear you.
Ma'am, I am reading. Hello, ma'am.
I cannot hear you.
Hello, ma'am.
Shah Wali, I cannot hear you. I
Diagnostic
think the
or
problem in at the Zoom. Wait a minute, please, guys.
hello, ma'am. Hello, ma'am. Ma'am, do you hear me?
Uh-huh. Вроде интернет нормальный, да? Это у вас привычка?
Нет, я это проверяю.
Я думала, у вас такая привычка. С последними днями нашей работы мы уже тут все с ума сходим. Классно, как надо проверять. Guys, you hear me?
Yes, ma'am.
Okay, okay.
Надо переключить. Вас не сбросит сейчас?
Не знаю.
Как дела, мэм?
Yes, ma'am. Пожалуйста.
Извините.
Вот и хорошо.
Lagi siya pa recording ni.
Мали бы сук-суки.
Ano to ko na subay.
لکه تعالی سره راځي که نه طلاق بس د سلاید نه ورته وایه که نه چې ته ورته هلته کې چپ شي او موبایل دې هم ورته راکولاو کړی
कसम नहीं कमाता है पता है कि कम दे हुए कि कम दे नो
Some position they can achieve the first year, the first semester, more sir bukun initiative la prete da nor.
Mung buku na rolin mung saksag daka uniwal.
तो खुला prete सड़े मारे इष्ट पास पेपर ये मारे पिलकड़े देखी वजरो गुदरी कम पोदरेगा.
Da sa shi la pel kada de bia.
Chemistry paper la पिलकड़े 97 number में आवाज वेब तला की ने
Nade
देजिम ने
nade
यूनिवर्सिटी.
fel nade fel aga başka ve de.
मैडम वर्क इन अगन पुई की कहना हेलो इंशरा बहन मैम को अलाउ ना करे आप होस्ट है ना मैडम को अलाउ ना करे
क्या चीज?
मैम को लेक्चर में अलाउ ना करे
ये मीटिंग लॉक तो नहीं है, मैम आ जाएंगी खुद ही.
लेकिन होस्ट तो आप हो ना
Password wala change kala ka.
ये ज्यादा लग रहा हूँ किसमें
यानी तू लेफ्ट कर ले
जी भाइयों ये देख लो ये अपनी अनाटमी की लैब है
ओए होए होए ये तुमने पहली बार देखी
भाई एडम यूनिवर्सिटी देखी हुई है
इस वेब को रखा हुआ है क्या
ये अपने ज़ुएब भाई हैं
अच्छा इसको भी रखा हुआ है म्यूजियम में
हाँ ये चपरासी लगा हुआ है
साथ को भी रख लो यार
ये अपने साथ भी हाई कर दो कैमरे कैमरे को देख के हाई कर दो
इसको भी रख लो इधर Пожалуйста, как дела, брат? साथ भाई कभी कभी लेक्चर लिया करो यार सेहत के
यार
लिए
दिल
अच्छा
बहुत
होता
करता है, मैं सोच रहा हूँ ये बस मंडे से लेक्चर लेना स्टार्ट करूँ वली भैया आपकी वीडियो नहीं आ रही
सही सही है मैंने उस पे वो टेप लगाया हुआ है ना
ऑन कर दो हम भी तो देखें
ताकि मैम को पता ना चले
वीडियो
ना देखो यार आई एम नॉट इन द पोजीशन
चलो यार आप क्लास लो हम थोड़ा चिल कर लें
ठीक है आप म्यूजियम में जेब भाई को वो करो क्या कहते हैं उसे
Hafisa, can you please give me
Yes, ma'am.
organization function, host organization function? Can you give me, please?
Yes, ma'am. Uh,
Thank you so much. Thank you so much, guys. Thank you for wait. I had a little bit problem with my internet and laptop. You hear me, guys?
yes ma'am
Okay. Спасибо большое вам. Спасибо. Okay, let's keep going our practices. I'm sorry. I'm really sorry for the some issue of my laptop and the internet also. Okay, let's try again to start our practices. Okay, let's start our practices. So we are stopping mm, at the tasks and at the purpose, at the task and at the purpose. Then we are talk about the diagnosis and or diagnostics. So I want to say we have a different diagnostic method. So please, Usama Rahman, read the slide. Read the slide, please.
Diagnostic technique, the study of method, observation, experimentation, physical and laboratory instrumental method. Epidemiology. Human science, symptomatology of
Okay,
symptom
yes, read please.
diagnostic method, the study of specific ML identification of the disease.
Okay, okay, then. So you can see guys that diagnostics, we have different type of diagnostics. It is the physical examination, laboratory instrumental method, case history, and the science. So we call semiology diagnostics or symptomatology diagnostics. So see, we have different types of the diagnostics. So our job in this semester to talk about case history of the systems, to talk about the physical examinations of the systems, and also to learn some of the topics about the laboratory instrumentals, and also symptoms of the diseases or symptoms or signs of the some diseases. This is our task actually in my subject. Okay, can you tell me please guys, who knows what does mean symptom? What does it mean symptom? Uh,
Yes, ma'am.
yes, I listen to you.
Yes, ma'am. The sign or the appearance of disease according to the patient's subjective feeling.
Okay, so it means when the patient says what the problem with him, right?
Yes, ma'am. The patient feeling the feeling and express it to the doctor. This is called the symptom, while the sign or the doctor or the physician detect by the patient.
Okay, can you tell me please what does mean disease? Not disease, what does mean syndrome? I'm sorry. What does mean syndrome?
Ma'am, simply the syndrome is the collection of sign and symptoms.
Okay, so syndrome, it is the set of the symptoms and signs, right?
Right, ma'am.
But they should to have one pathogenesis. One pathogenesis. Then it will be syndrome. For example, syndrome of the bronchial obstructive or syndrome or heart failure syndrome. So see guys, syndromes you will study at the next semester. So with me, we will study how to check the patient and some symptoms. Okay, can you read this slide, please, Mariam Sabir?
Yes, ma'am. Symptom, Greek symptoma, sign, a sign, appearance of disease according to patient's subjective feeling or objectively detected by physician. Syndrome, the set of symptoms based on common pathogenesis.
Okay, signs. So, according to the patient subject, what does mean syndrome? We understand it is the set of symptoms based on common pathogenesis. On common pathogenesis. Okay, let's keep going. Okay, let's see. Internal medicine specialists. Internal medicine specialists. In my subject, actually, we will study five systems: cardiology, cardiovascular system, respiratory system, GIT system, also nephrology system, and rheumatology system. So for all our subject, therapy subjects, if you're gonna be, we will study this is the systems. Then, what do you see at the picture? What do you see at the
Excuse me,
picture?
ma'am.
Yes,
Ma'am, please explain the slide number 17. International Statistical Classification of Diseases.
this one.
Yes, ma'am.
International Statistic Classification of Disease, or we call ICD-10. What is this one? This is the book. Actually, it looks like this one. ICD-10, it looks like this one. When you become a doctor, when you graduated graduated our university, then you go to be a doctor. You should, when you are get the, for example, get the full name of diagnosis, and you should to find in this book where is classified. See, they have the number C66, C65, and you should to put the right number of your diagnosis in your case history. Okay? C. Classification of mental and behavior disorders. This is the ICD-10. So in the ICD-10, it means 10th review or 10th editions of the ICD. So this is the classification of the disease. When you will write in your case history, you should to find the numbers and put in these numbers at the case history. Or for example, you are something happened with your psychiatric problems, for example, but this is the psychiatric problem you cannot, you don't want that your colleagues, your friends, or your job boss know about your disease. So that's why in the document they put only the number. For example, C70, C70. So not name they put the number of the disease, because this is disease, this is not should to be is not necessary that everybody know. It is the, like a very private problem, the patient. Very private problem, the patient. That's why we use this, the ICD-10. When you will start a doctor, when you will start your experiments, practices of doctors, you will understand. Okay.
Okay, ma'am.
Okay, let's see. What do you see at this picture, guys? The number one, the first step of the investigation of the patient, it is what? It is the collection of information or making a case history, right?
Ma'am, in this picture, we see the ethics of the doctor toward the patient. How
Okay,
to
what
deal
you
with the
see
patient.
at the picture? Next picture.
Ma'am, history taking of the patient.
History taking of the patient. Okay, yes, let's talk about the history taking. How we call another name of the history taking. Okay, what this one? How we call this is process?
Ma'am, physical examination.
Okay, physical examination consists of what?
Diagnostic, ma'am.
No, physical examinations consist of what? What does she do? Look at the slide. What does she do?
Palpation of
Palpation, yes.
yes.
Palpation, yes. Then what they do? What does he do? Percussion. This is the percussion. And what is this one? Guys,
Escalation.
auscultation. Auscultation. So physical examination consists of what? Physical examination consists of what? Reply me, guys. Who knows? Reply me.
Auscultation, ma'am. Palpation.
Yes. Auscultation, palpation. What else? Percussion. And one more. Inspection. Inspection. Physical examination consists of inspection, palpation, percussion, and auscultation. Okay? Okay, guys? You understand
Okay.
me?
Okay,
Okay,
ma'am.
ma'am.
Yes. So today in my practices for today, we will talk about the case history. Okay? Case history. Or how we call, look at this. Actually, case history, it looks like this one. It looks like this one. Or in your clinic, you can have the case history like this outpatient appointment card. But I have questions. Case history, actually, we call anamnesis. We call anamnesis. Read this slide, Mariam.
Anamnesis, history take recollection, medical or psychiatric patient case history, particularly using the patient's recollection, is a set of information about the patient obtained by questioning.
Okay. So anamnesis actually come from the what? From the Greek words, anamnesis actually come and it means memorize. Anamnesis actually, if we translate from Greek language, it means memorize. So history taking, actually, we will call anamnesis. Anamnesis consists of anamnesis vitae and anamnesis consists of anamnesis morbi. Okay? So anamnesis consists of what? Case history has components or include something. What include case history? Osama Rahman. Osama Rahman. What include case history?
Recollection, ma'am.
No, I ask about the components. Case history has the components. What include what include components of case history?
Biodata, ma'am.
No,
Hello, ma'am.
no. You hear me, Osama Rahman?
Yes, ma'am.
Read the slide. This is the scheme or plan how to write the case history by using this scheme. Read the slide, Osama.
Identifying data and source of history, reliability, keep complaints, present illness, past history, family history, personal and social history, review of system.
Okay, a review of some system. So can you tell me please guys, write in your copybooks. Write this slide in your copybooks, please. Not screenshot, not take picture. Read, write in your copybooks. Because when you write something in the copybooks, you will remember in like 70-80%. If you only see and listen, you will remember only 50% of information. So that's why writing your copybooks, this one is important because your whole case history will consist of these points. Okay, now let's talk about the identifying date. Identifying
Wait
date.
a minute, ma'am, please.
Okay, right. You done? So identifying date. What does mean identifying date? How you understand? What we should record? We are actually record the personal details of the patient. But about this one, before talking about the components of the history taking, read this slide, please. Shah Wali Khan. Shah
Patient
Wali.
history and physical exam is the cornerstone of medical diagnosis. Importance of history taking. Obtaining an accurate history is the critical first step in determining the theology of a patient problems. So, ma'am.
Okay. Okay. So you see, guys, if you take good history taken from the patient, if you do good physical examinations, it doesn't need you don't need to send the patient go to the ultrasounds, go to the x-ray or check the blood test and everything else. This is the cornerstone of medical diagnosis to take a good history and physical exam. If you will do this one rightly, goodly, so you can easily give the diagnosis of the patient, right diagnosis. In 90% you can give easily 90% you can easily give the diagnosis to the patient. Okay.
Okay, ma'am.
Okay, so let's talk about the number one, identifying date and source of the history. We are talking about the record personal details. Read this slide, Mariam.
Record personal details. Always record personal details: name, age, address, sex, occupation, religion, marital status. Record date of examination and admission. Mr.
Okay,
Ali
so
Khan, 55-year, 5 month.
okay. So you can see, guys, what you should to do. You should to record the personal details of the patient. It is the one of the first components of the case history. So, Mariam, you are a doctor. I am a patient. Ask me.
Okay,
Mariam,
ma'am.
you are a doctor. I am a patient. Ask me.
Yes, ma'am. So, what's your name?
My name is Guljan.
Age?
Is it enough for you? My name is Guljan.
No, ma'am. Surname also.
Yes, we should ask full name. My name is Guljan Almazbekovna. Next one.
What's your age?
I am 30 years old, lady.
Home. Where do you live?
I live in the Kyrgyzstan, in the Bishkek city, Молодая гвардия 54.
Okay. So, what's your occupation?
I am a teacher and I'm a doctor.
And your marital status?
I am a married.
Okay. So, what problem do you have?
No, now you forget about what? You didn't ask about my religion. You didn't ask about my gender. And you didn't even say about the date of examination and admission. So, guys, please write in your copybooks, record personal details, write in your copybooks, name, age, address, sex, occupation, religion, marital status, record date of examination and admission. So, what day today, Mariam?
Ma'am, it's 3rd April.
On the 3rd April? Full. I need a full answer, Mariam.
3rd April 2021.
Time. I need a time. If you notice, you should also give me
12
time.
p.m. Ma'am,
Yes.
it's 12 p.m. in Pakistan.
Okay, so you understand now. You never forget to put date of examination and admission and even the time. Even the time. Okay,
Yes, ma'am.
let's talk about the source of history. Hafisa, read the slide. Read the
Yes, ma'am.
slide.
The source of history or referral can be the patient, a family member, or a friend, an officer, a consultant, or the clinical record. Identifying the source of referral helps you assess the quality of referral information, questions you may need to address in your assessment, and written response. The prosecutor, the patient was admitted accompanied by a friend.
Okay, so what does mean source of history, Hafisa? What does
Ma'am, the person from which we take the patient's history, it can be patient himself or his family member or friend, anyone. Or also his in form of written paper, something from his past.
okay, okay, thank you, you understand. Okay, let's talk about the next component of the history taking, the chief complaint. What does mean chief complaint, Osama? How you understand chief complaint? Osama, how you understand the chief complaint? Osama, how you understand the chief complaint?
Hello, ma'am.
Yes, yes.
Chief
How you
complaint is
understand the chief complaint? Yes.
main problem, ma'am.
Uh, Mansur Khan.
Yes, ma'am. Ma'am, chief complaints are the main problem. These are the symptoms which made the patient to come to the doctor.
Okay, read next slide, Mansur Khan.
Yes, ma'am. Definition. The one or the more symptoms are concerned causing the patient to seek care. The main reason pushing the patient to seek for visiting a physician or for help. For example, chest pain, palpitation, shortness of breath, ankle swelling, etc. The patient describes the problem in their own words. It's recorded in the patient own words. A possible question: what brings you here? How can I help you? What seems to be the problem?
Okay, so now you are a doctor, I am a patient. Ask me, Mansur.
Hello, ma'am. Assalamu alaikum. My name is Mansoor Khan. Dr. Mansoor
Alaikum
Khan.
assalam.
How can I help you? Ma'am, first doctor ask about your biodata. For example, name, age, sex,
Yes, yes, yes. We
occupation.
did it. We did it. We are talking about the chief
Yes, ma'am.
complaint.
Yes, ma'am. Now, ma'am, the doctor asked about presenting
You are a
complaint for the
doctor,
chief
I am a
complaint.
patient. Ask me.
Yes, ma'am. What brings you here?
Doctor, I have a headache.
Okay, ma'am. When the
Okay,
headache start,
okay. Wait a minute. So, what you will put to the chief complaint?
ma'am, in chief complaint, we put the duration of the each complaint. For
So, what
example,
I am a patient. You are a doctor. What you will put? What I said?
sure.
My complaint. What I said? I am a patient. What I said?
Okay, ma'am.
I said headache. I said
Okay.
headache. So you put in the chief complaint headache,
Yes,
right?
ma'am.
If
Duration,
I say to
duration
you,
of the headache.
wait a minute. If I say to you, I have headache, chest pain, vomiting, stomach, what you will do? What you will put in the chief complaint? Mansoor, I'm talking with you.
Yes, ma'am.
What you will put in the chief complaint?
Ma'am, I written headaches.
Only headache, I said I have.
Yes,
I
ma'am.
have vomiting, I have fever, I have chest pain, back
Yes,
pain.
ma'am. Ma'am, I written all these according to the duration.
No, you will write in the chief complaint all my complaints. If I said I have headache, stomach, backache, everything else, you must to write all my complaints.
Yes,
Okay?
ma'am.
Yes.
Okay.
Mansur, not Mansur, everybody please write the last sentences, possible questions. What brings you here? How can I help you? Write in your copybooks. How can I help you? What seems to be the problem? And write also this one. The patient described the problem in their own words. It is recorded in the patient's own words. So see, you should, Mansur, put in the chief complaint my complaints, how I say, so you should to write, because I am a patient, you are a doctor. By using the own words of the patient, you put the complaints of the patient. Okay, so please write these sentences. The patient described the problem in their own words. It's recorded in the patient's own words. And please write these sentences. Possible questions: what is brings to you here? How can I help you? What seems to be the problem? Okay.
Okay, ma'am, we are writing.
Okay, next one, where we go to the next components of the case history. It is the history of present illness, or guys, we call anamnesis morbi, anamnesis morbi. So anamnesis consists of two parts, anamnesis morbi and anamnesis vitae. So, history of present illness, if we translate in Greek languages, we will call anamnesis morbi. Can you tell me, please, guys, now, in this is the components, what we will do, Hafisa?
What, ma'am?
What we will do and what we will put in this history of present illness?
Mm. We will write it down according to the chief complaints told by the patient, and um, collect relevant symptoms, like if patient has told us 3 to 4 symptoms, then we will try to find out which syndrome will it become.
Okay, Hafisa, read the next slide. Read the next slide.
Yes, ma'am. History of present illness tips. Elaborate on the chief complaints in detail. Ask relevant associated symptoms. Have differential diagnosis in mind. Lead the conversation and thoughts. Decide and weight the importance of minor complaints. In details of present problem with time of onset, mode of evolution, any investigation, treatment and outcome, any associated positive or negative symptoms.
So see guys, what we should to do. We should describe more in detail our symptom. And how we will do by using this is the scale. Number one, duration. Number two, onset, sudden or gradual. Number three, what has happened since constant or periodic, frequency getting worse or better. Number four, precipitating or relieving factors. And number five, associated symptoms. So please write in your copybooks this one: duration, onset, sudden or gradual, what has happened since, constant or periodical, frequency or getting worse or better, precipitating or relieving factors, associated symptoms. Associated symptoms. Okay.
Okay, ma'am.
So what we will do, we will, you are a doctor, Hafisa, I am a patient. I said I have a headache. What you will do with my headache?
I will ask you about the duration of headache.
Ask me.
Okay, so when did the headache start? Like this, ma'am, or something else?
Yes, yes, ask me how long I have my headache. I have my headache, 2 days. Then,
Okay, so was it sudden or gradual?
oh, my headache, it's startly, suddenly.
Okay, so after it started, was it constant or periodic?
It was periodically, like sometimes at the morning, sometimes at the afternoon.
What was the frequency of headache? Like how severe it was?
3, 4 times in a day, I have a headache.
Okay. So is it getting better or worse?
It is getting
From
worse. That's why I come to you.
okay. So
Next.
did you take any medicines which relieve the
No,
your
I
pain?
didn't take any medicine.
Do you have any other symptoms other than headache?
I don't have other symptoms, but you didn't ask about the precipitating or relieving factors. What does it mean? It means what was the reasons that start my headache and what was the reasons that stop my headache. It means precipitating or relieving factors.
Hmm.
Okay, so
Okay,
ask
ma'am.
me.
Okay, so what was the reason that started your headache?
Oh, job, due to job, because we have a huge job at the university. It's something like a stress, I think.
Okay. So what was the reason that relieve your headache?
Um, my relieving factors, I didn't take anything. So my relieving factors is what? Nothing help, only rest. If I have rest, I think it will be fine.
Okay, ma'am.
Okay, thank you, Hafisa. So see, guys, you should to keep your scheme in your mind, because if you will ask like something different, ask different, not exactly questions, your stories will be huge and not necessary. You should to keep in your mind directly what you need from the patient, because for the patient you have only 15 minutes to check the patient. In the 15 minutes you should to take whole history of the patient and do the physical examinations and give the working uh, diagnose. For one patient you have only 15 minutes. Okay. But guys, that's why you should to write this one and keep in your mind the scheme. The next one, where we go to the past medical history. Write this slide, Mariam. Write this slide.
Yes, ma'am. Past medical history provides information about what medical problems the patient has had in the past and potential problems that might be in the patient's future. Past medical history includes what chronic illness does the patient have, if any, is the patient taking any medication, past hospitalizations, does the patient have primary care physician or allergies.
Okay, so what we will do in the past medical history, Mansur? Mansur Khan.
Yes, ma'am.
What we will do at the past medical history?
Ma'am, we will ask the patient
Okay. What we will ask
for
the patient?
ma'am, asking the patient for by his past any illness or disease.
Any illness or disease. Okay. And we will use these questions. Write in your
Yes,
copybooks these questions. What chronic illness does the patient have, if any? Is the patient taking any medication? Past hospitalizations? Does the patient have a primary care physician? Allergies. So, Hafisa, you are a doctor, I am a patient. What you will ask from me? I said I have a headache and I describe my headache. What you will ask in the past medical history?
Do you have any chronic illness?
No, I don't have.
Okay. So, are you taking any medicines?
No, I didn't take and I don't take.
Were you ever hospitalized?
No, I didn't hospitalize. I didn't go to the hospital.
I'm very curious. Ma'am, what is this? I can't understand this question.
Oh,
Does the
it
patient?
means did I go to my family doctors?
Okay.
No, I
So,
didn't go. I come first time to you.
okay. Do you have any allergies?
Yes, I have allergy on the amoxicillin drug. Amoxicillin antibiotic drug. You know, guys, I want to say about the allergy. Allergy is it's very important points. Never forget ask about the allergy from the patient because if you give the patient some drugs, the patients if the patient has the allergy, this the patients can die from your drugs. So this the patients can have allergic shock. Allergic shock, you know what it means almostly die. So that's why allergies, especially the drugs allergies, is important. Okay. Okay, but past medical history we also call anamnesis vitae. Anamnesis vitae. So present medical history is anamnesis morbi. Past medical history is anamnesis vitae from the Greek language. Okay, let's see. You also should ask about the childhood diseases, for example, measles, rubella, mumps, chickenpox. Also, adult illness, medicals, surgical, gynecological, psychiatrical, and then you go to the family history. In the family history, it is important that some genetic problems of your families, grandparents, grandmothers, did they have hypertension, diabetes, sickle cells, or are other genetic diseases? You also should to ask the patient. Then the last one, what you need to ask about them social history, life, educational level, occupational exposure, travel history, marital status, children, network of support, barriers to healthcare access, barriers to patient compliance, and substance abuse history. So the job is like that. Um, you need to make a dialogue between patient and doctors by yourself by follow the scheme. By follow the scheme, how I show to you. After this one, you need to put in the Moodle task number 2. There is the task number 2, dialogue between the patient and the doctor. So you write in your copybooks these dialogues. You label all the pages of your copybooks. If there is no your name in the every page of the copybooks and number of group, I will not check it. Then after this one, you take picture. Please try to take picture and try to write more better because I need to check more normally. Sometimes I cannot read even what you write it. So that's why please write normally that I can check. I can read it. Then you should to take picture and put submit in the Moodle task number 2. Okay, is it understandable for you? You
Okay,
have some,
ma'am.
Okay,
you
ma'am.
can ask. Okay, if you don't have questions, the next
Excuse me,
one,
ma'am.
yes, please.
Ma'am, why we ask the patient about its religions?
About what?
Religion, ma'am.
Religion. Because religion is also important because uh, there is the like, for example, Islam, Muslim people, some of them, Muslim people, some of them, they are don't take vaccination. For example, some of the Muslim peoples, they don't want to do the vaccination. So we should to put it, this is the way in the case history, and remember that maybe and ask about the vaccination. For example, if you are Muslim, if your religion, so did you take the vaccination in your child time or something like that? That's why religion also important. Okay.
Okay, ma'am.
Okay. The next homework, it is the examination, general examination. So you should to learn by heart about the general examination. You need to follow MacLeod's examination books. Okay.
Okay, ma'am.
Yes, so please also inform your group mates, inform your leader of the groups. Leader of the groups should to be responsible for your members of the group. So if something happened with the students, so your leaders of the group should text in the group leaders. Okay?
Okay, ma'am.
And please do everything on time, don't be late, and also come to my lectures because my practices depends on my lectures. Is it understandable?
Yes, ma'am. Yes.
Okay, thank you everybody. Bye.